Good morning, everyone. We want to thank you for joining this session. We have a quick poll available right now, but we'd like if you could participate, and thank everyone who has been participating with this quick poll. We want to know if your facility is currently accredited, and if you can give us your poll responses, we appreciate it. We also have the opportunity to enter questions in the question section of the GoToWebinar tool. Well, we're going to go ahead and get started, and we want to introduce Yvonne Rockwood. Yvonne Rockwood is the Associate Director, Community Behavioral Healthcare for the Joint Commission. Spanning 25 years, Yvonne has overseen services in numerous settings, ranging from community agencies, outpatient and inpatient behavioral healthcare, intensive outpatient, and partial hospitalization programs. As a healthcare administrator, Yvonne has led numerous accreditation surveys for her organizations, offering numerous firsthand experiences. Yvonne can articulate both the challenges and rewards of the process from her experiences. Yvonne holds both a master's in healthcare administration and master's in business administration, as is a certified professional in healthcare quality. Welcome, Yvonne Rockwood.
Thank you so much. It's just a pleasure to be here. I am going to go ahead and share my screen, but if you could close the poll, I think people will see it. All right, very good. Welcome again, everyone, and thank you so much for attending today. And I'm going to go ahead and share my screen. Nestor, can you see the PowerPoint that's up?
Not yet.
All right, just one moment. Poll is blocking me for a minute. All right, now?
You are good now.
All right, very good. All right. All right, let's get started. And I'm so happy to be here, everyone. I am, as Nestor said, I'm from the Joint Commission. And in terms of the poll, can you give me a little bit of feedback in terms of the crowd here today? How many, is it 50% accredited or 0, or just so I can tailor it a bit more to your, to your needs of the audience?
Sure, Yvonne, we're seeing, looks like 65% are showing accredited, 20% no, 15% I don't know.
Okay, very good. That's a good combo. So even for those that are accredited, my thinking was that this would be, valuable to you. It's a little bit of a refresher, but no matter what point you are in the process, at the end, you may have some questions, but feel free to put them in throughout as well. I'm going to watch my time so that I'm done in 30 minutes or less, and will give us a good 15 minutes for some questions and answers. And this is meant to be a conversation and your session. So here we go. All right. All right, so just a little overview of what we'll cover today briefly is, a brief overview of accreditation and, what is the Joint Commission difference? How do you prepare? And what is the timeline? What time, what amount of time do most people, from start to finish, become accredited? And then the survey itself and the resources we have for you. All right, so let's start out with accreditation. And here is a, basic definition, but I think it's important because as you work with your organization, they'll, why are we getting accredited and what is this? And it's, please never say it's something we have to do, okay? It's something that you're volunteering to do. And it's really a high caliber process of inviting people into your organization so that we can validate your safety and quality. And at the end, there may be some improvement recommendations. But it is a, it demonstrates to the community, to your physicians, to your clients, to your payers, that you have gone through this rigorous process and that you are a high caliber organization. Okay, so what will it do for you? What will accreditation do for you? And if you're not the CFO, you will be asked this question. And certainly, even if you're in a management role, you're gonna ask this question. And really, what it does for you is several things. it demonstrates that your organization has a commitment to quality and safety, and it differentiates you from all the others in the community. Joint Commission is well known nationally and internationally. When they see our seal, there's a sense of relief that this is a quality organization. All right, and the second thing it does, and I really experienced this firsthand, it provides a management framework so that you have a culture of excellence, and our accreditation supports that culture of excellence. It integrates data into your daily operations, and here's where Kipu comes into play, because you can gather that data easily and really provide it for the Joint Commission. And this is an important area, and the why might have started out with reimbursement options, but it ends up, more than that, but really expands your reimbursement options. You have the ability to have health plans include you in their network, Medicaid, Medi-Cal, and many other payer sources. Even licensing sometimes requires it before you can obtain your license. Just a quick overview, and I'm going to breeze over this, but you may or may not know, depending on how familiar you are with the Joint Commission, but we've been around more than 75 years. We've been accrediting behavioral health for over 50 years. Some people are a little surprised with that because we started with hospitals. Sometimes there's the myth that's all we do, but you can see the list down there of everything we accredit, and we accredit the whole organization, not just bits and pieces. So that is a unique philosophy of the Joint Commission. And I think it's an important one because it's your organization that's getting the gold seal, not just a specific program. But we have over 22,000 programs nationwide right now, over 22. Here's a quick map to show you the density. The green areas are the most dense accredited organization or accredited states, but you can see we're in every single state. All right, and we have over 11,000 sites across the United States that are both accredited for Joint Commission, but I haven't included certified. You hear those two words and people sometimes think they're one and the same. And for Joint Commission, accreditation means that you have been awarded the gold seal. Certification is above and beyond accreditation. And right now, the Joint Commission Behavioral Health has the Behavioral Health Home accreditation. And we can talk about that a little bit more if someone is interested in having me explain. But what the Behavioral Health Home is that you are providing either through coordinating with a physical provider or directly, you're providing some physical care as well as behavioral health care. And as a quick overview, we are recognized in all across the United States. We are federally deemed by SAMHSA as an approved opioid treatment program. In fact, we go way back with SAMHSA. We have we use the word recognition, and we are recognized in several states and districts in the United States. And what that may mean, depending on your state, is that once you're accredited with the Joint Commission, you may not have to go through any state surveys. It varies from state to state. Once we start working together, we'll find that out for you, okay? Okay, and before I go on to why the Joint Commission, I also wanted to say, why are we recognized? Why might you not have to have a statewide survey? And the reason for this, and the reason that providers contract with you more readily if you're accredited, is that they know the rigor of quality and safety that we've gone through. And so for them, it reduces their risk. It satisfies the requirement that they have to be sure you're providing quality care. So there's a reason behind that. All right, now I want to talk about why Joint Commission, why us? All right, again, I've mentioned this before, we're widely respected. Almost no one in the healthcare industry doesn't know Joint Commission. And that gives you an advantage to the entire healthcare community for those that are going to refer to you for clients and patients that might be considering you. I know that's something I always look for when I'm looking for a quality organization. We have a website that indicates who is accredited with us that you could go to anytime. Okay. All right, here's some unique advantages, and this is where I hope you will kind of focus in, because not only is our reputation and the recognition there, but we are very well known for flexible timing and support to meet your deadline. So people always ask, well, how long is it going to take? Well, it can take as little as 2 months if you've really got some good resources and you've done your work, or it could take up to 12 months. Now, most people take 4 to 6 months after they put in their application, because we provide you with resources and tools and guide you along the way. No matter what date you are surveyed, it is your choice. You tell us when to come, and we want you to be ready. So we'll work with you on that. But the third bullet says, even though it's a 3-year, or even though actually the payment structure is annually, we always award a 3-year accreditation. You'll not ever get anything other than a 3-year. All right, and in terms of our standards, for behavioral health, they are non-medical. They are customized to the industry, high caliber, and they're non-prescriptive. So by non-prescriptive, I mean that we're not going to tell you what to do. We're going to ask you to have certain things in place, and then you're going to show us what you have in place, and we'll hold you to your own policy. Okay? All right. And again, we give you a framework for how things work in your organization, and we have, robust process improvement. With you come into the Joint Commission, you're going to get ongoing support, ongoing strength of our whole organization to provide you with complimentary webinars, complimentary resources, and consultation anytime along the way. All right, I've gone through this a bit, so I'm not going to dwell on it. But one thing, the third bullet down, is that we use something called tracer methodology when we conduct our surveys, and that is unique to the Joint Commission. What we do when we come in is we will ask for, maybe 3 clients, and then we will trace their care from admission to discharge if they're ready for discharge, but we'll find out how they came through the system, what you collected when they started, and the progress throughout. And the progress throughout, there's going to be different touches from your clinicians and your staff, and then we'll evaluate their HR files. So rather than just look at all paper and process and administrative policies, we're going to look at how you operationalize it. And it's really a fun process. All the staff that I've ever had just really enjoy it because they get to tell the good work they do, and they're proud of it, and they should be. And so finally, what is the Joint Commission difference? It is a dynamic partnership, and it's meant to be a dynamic partnership, not just to get accredited, but the whole time you're with Joint Commission. All right? Yeah, we're doing pretty good on time. All right, so preparation and timeline. How long does this take us? How do I prepare? So for those that are accredited and listening, you will recognize that, whether you knew you were going through the steps or not, you go through a certain amount of steps. They're not always linear. They can be concurrent, but you're going to identify the applicable requirements, and we're going to provide you with a complimentary manual. Your manuals are always complimentary and updated annually for you, so you're never going to be paying for those. That's part of your accreditation. And then you're going to conduct a self. Much of these requirements do we have in place, and anything that is missing, you go ahead and put those in place. And then you go through your accreditation survey, and then there's some post requirements if you have anything to hand in. I'll go through this briefly. Here is a snapshot of our manual, and we provide both a hard copy manual and a electronic manual upon your request. Again, neither of those cost you anything. But here are the chapters over on the left. starting with accreditation participation requirements, and you go down to wave testing. So there are 15 chapters there. If you don't do any laboratory tests on your site, the wave testing chapter will not apply to you. But each of these have some requirements, some documents, some are longer than others, but they're all important, okay? So what we start with the standard, and the standard is what do we expect of you? The rationale we provide then is why do we do it? Why are we asking for it? And the elements of performance we call EPs. And those are the building blocks, but kind of more importantly for you, it's exactly what the surveyors are going to look at. So we have the ability to filter this manual and customize it accordingly. And I'll show you what that looks like. All right, so now you can see a snapshot of the manual as we've opened it. This is the landing page. And what we're going to do here is go up to, see if you can see my cursor, up to service profile over here. We're going to click it, and we're going to tell the manual what it is that you do. Now there's a number down there to call if you would like a complimentary copy of your, of your electronic manual. It is a 90-day manual, and it will disappear on you in 90 days, but you can always request a second time around if you're still in the evaluation process. Okay, and here's what it looks like when you open that little item that says service profile. We're going to ask you to select what kind of service you provide, and then medication is down below. And over on the right-hand side, if you provide any human services, meaning child welfare, intellectual disabilities, recovery and resilience, you check there as well. And we talk through all of this. We have a definition that kind of follows us as we go along. So if you're wondering if we define it the same way you define it, we can look that up. Some people have lots of things checked, others have a few. And the beauty of doing this is that it's going to filter out what isn't applicable to you. And so there's no need for you to look at something that you don't provide. Okay, and I couldn't fit it all on one page. So here we're going to ask you also your settings. Are you residential, outpatient, community-based, and etc. And again, if you have any questions about how we define that, we'll walk you through that. So I talked about doing a gap analysis, looking at what policies, procedures, or practices that you have in place. And if they're in place, you can check the box, I'm done. There's going to be some quick fixes. Maybe you have a policy or practice in place, but it's not as robust as the Joint Commission is asking for. So there again, you do a quick fix and you get it up to the gold, all right? And then you're going to find some gaps. Most people do find some gaps, and you just go ahead and put those in place before the survey. Again, you have our guidance to help you through that. We have, I'm going to just pause for a minute to tell you, we have a whole department that's called Standard Interpretation. And they're there for you at any time to ask any question about any standard. So if you had a question about how do I satisfy this standard, they'll help you. Is this standard applicable to my organization? They'll help you. And whatever they say is the answer, because they interpret the standards for us. And they're available to you the whole time you're with the Joint Commission. Now, and when you apply, and after you become accredited, that doesn't stop. That's your consultation department for you. So when you're preparing for Joint Commission, we're really looking, for this to be a team effort. Now, I know some of you are very small, some of you have more resources, so this has to be adapted. And I've been in that same situation. Early on, it was just me and, maybe a few key people. And later, as I grew into larger organizations, I had more of a team to work with. But either way, you want to assign someone who's a champion and hopefully, spread out the fun of looking at all the chapters and being sure you're in compliance. Now that does a few things. It takes the pressure off one person, number one. Number two, it spreads the word that this is going to happen. You're going to go into accreditation. And, we want this team to inspire your staff, to let them know that, we are a credible quality organization. And through this gold seal of approval, we're going to prove it, okay? And it enhances communication. Because I said with the tracer methodology, the surveyors don't just sit in one room and look at policies. They'll go out into your organization and see how it works, see how the daily operation works. So you want your staff to be comfortable. And then there's other considerations, of course. I've got over here, do it yourself, meaning a team if possible, or hiring a consultant. A lot of people think, well, should I hire a consultant for this? Well, we recommend that you use our resources first, because we have a robust set of resources and departments, and give it a month or so before you consider that, because that is built into the cost of your accreditation, is helping you with these resources. So, but what might drive this decision are your timeframes, the cost of accreditation, and when I say human resources, I mean how many people are there to help you, okay? And are you a brand new organization, or have you been around for a while? All those things are going to help you make those decisions. And then other resources to consider is peer organizations. And what I mean by that, if we can connect you up with anyone who's already accredited, excuse me there, and you can have a collaborative relationship and bounce things off them. We step away and let you have that conversation. And then your state and national associations that you're probably already a member, and of course Kipu is one that is supporting this process. So finally, and this is getting toward the end, is that we're going to talk about the application process and the survey. So when you're ready to apply, which typically is, after you've reviewed the manual a bit, you're going to decide how long you are, going to need to get ready. However, we don't want you to wait till you're 100% feeling like you're ready. And the reason for this is because once the application is submitted, your resources and support start in full, okay? So you're gonna want to request an application, and that's from someone like me, and I'll show you the rest of the team. And you submit that application, and I walk you through it. It's a very short application, takes about 30 minutes if we do it together. And what that does is it tells our organization that you're in the system. It gets you lined up for survey, even if it's a projected date, not your actual date. And it tells what type of surveyors that we're going to send out. We do offer two kinds of surveys, a virtual or an on-site. And so depending on which one you're going to choose, your surveyors would either be selected in areas that are close to you so they can deploy out for the survey in person, or we'll get the virtual survey set up for you. All right. Now, when you apply, we do ask for a $1,700 non-refundable deposit. But this is not a deposit fee. It is not an application fee. It goes toward your annual fees, and I'm going to talk about those fees in just a minute. If your annual fees are, I'm just going to use a round number, $2,000 a year, then you pay $1,700 and you owe $300 for the rest of the year. That's how that works. Okay, here we go. I said I'd let you know how our fees work. And down at the bottom there, our fees are based on the type of service you provide, the settings, and your volume. So it doesn't matter how many sites you have. We're looking for your overall volume, the different types of settings, and the types of services you provide. And we have a worksheet. We'll share it with you how we come up with that. Obviously, those that are smaller are going to have a smaller, a lesser fee, and the larger organizations will have a larger fee. But the one thing about the fees is that they work in bands. So if you are at a certain volume, let's say 1,000, and your fee is 1,930, it's going to take quite a bit of volume for you to jump to the next level of annual fee. And I'll show you all that as we get closer, whenever you want. A lot of people start with the fees because they want to know if they can afford it. And so I've mentioned the fees, and there are two types. There's an accreditation fee, and that is billed annually instead of 3 years in advance. So instead of asking you to pay 3 years in advance for our 3-year accreditation cycle, we break that fee into 3 annual payments, and that's what that's about. Your survey fee is billed separately, and that happens after the survey is complete. You're going to have an estimate before you get started, though, what that fee is going to look like, so you won't be surprised. All right, I think I got one more down there. Okay, and other people say, well, what are the other fees? What are the hidden fees? Do you charge us more if more surveyors come? Do you charge us more if you spend more time than you thought you would? The answer is no. You're going to know your fees before we get started on the application process. That's very important for you to know and to plan for. You're going to get your manuals complimentary. You're going to get resources, complimentary webinars, which some of you may have already attended because they are open to the public. But I will periodically give a focused webinar just for your site or your leaders if you find that you need some help gaining acceptance of the whole process or helping, dispel myths. So we're happy to do that. We're here for you. We're going to provide an account executive after you apply. And that account executive, in addition to some other representatives, but that person is in particular going to be a coach, and they're going to be with you the entire time you're accredited with Joint Commission, as long as they don't retire, okay? So some people have had their accreditation coach for over 20 years. Some people have been accredited with us for 30 years, and we hope that's the case for you. But that person is going to be your coach. They're going to know you. They're going to know how to direct you. And that eliminates trying to find the right resource in the Joint Commission because your coach is going to get you there, okay? And then the last bullet there says it's going to assist you in post-survey activities. And that is definitely true. They will help you in that regard as well. All right, so this talks about what we call your Connect site, and I'm not going to go through it all. When you submit your application, you'll get an orientation to what we call Connect. Connect is your specific extranet site where you can find everything, hopefully you need, from who is your account executive, where do I find Edition, because now that becomes permanent, customized, and on your Connect site at all times. You can find our leading practice library that has best practices, some publications that we have out there, and access to the standard interpretation department that I talked about. So it's really your go-to guide for just about everything, and when you can't find what you're looking for, you call your account executive and they will guide you through it. Now, there's no time today to watch this, but I have inserted it into the presentation, and I believe the presentation will be available to you. So you can just cut and paste that little link down below. But this is worth watching. It walks you through a behavioral health survey, talks you through what might happen during that time. And I think it's really great to share with your staff as well. So now we're getting toward the survey, and we're actually getting toward the end of our presentation as well. So you're going to get a notice of your survey, and it's going to be 30 days in advance, okay, for all behavioral health surveys. There's some little asterisks there. If you're part of a hospital, you still get the 30-day notice, okay? And the on-site survey process, and they talk about that in the video, but you're going to get an agenda before you start. You're going to know who your lead surveyor is. You're going to know an approximate time that they're going to spend with you. And, they're going to talk about, different meetings they might have with you and the tracers. And so it's not just paperwork. They're going to come in, and the first thing they're going to do is have an opening session. And they're going to ask you to tell them all about your organization. And of course, it's down in paper, but there's nothing like hearing it from you. You know, what do you do? How long have you been doing it? You're proud of this. And, you know, you can spend some time doing this either informally or formally. People do it different ways. But we ask for, you know, give us, you know, 10, 15 minutes and tell us all about you. Then we will explain the tracer methodology and how that works. They're going to review your environment. And even if you do this virtually, you'll have somebody that will walk through the organization with a laptop or an iPad to show them your office. We do have a data session. You know, how does your organization use data? And here is where Kipu comes into play. You're going to be able to easily access this and, you know, really talk about what that data means rather than trying to find it. And then they're going to talk about competence of the staff. You know, how do you screen your staff? How do you know they have the credentials they have? Okay, and how often do you do an annual review? Now, I mentioned this before, the on-site, when the on-site comes, not only will you have an opening session, but every day that they're there, they're going to have a few daily briefings at the start of each day and at the end of each day to tell you what they plan to do, what they did do, and if there's any gaps that they're still looking for. At the end, you're going to have a leadership session and a closing report. You can, I've had it different ways. Sometimes I've had the leadership session just with me and a few key staff, and then we open it up to the entire organization. And, you know, Joint Commission invites as many people as you would like to hear the final report. You'll get that final report verbally and some written information, but it won't be formal. Within a day or two, you'll get your formal report, and if there's anything to hand in. So here we go. Your survey is done. You got a very good feeling. You're on your way to accreditation. I might say that it happens once in a while, and it happened once to me. We were accredited on the spot. And that is just exhilarating when that happens. At the same time, I thought, don't we have anything to improve? And I think we sure did. But, you know, I'm going to take it one way or the other. And I've been through at least 10 Joint Commission surveys in several settings because the organizations I was with and oversaw was an integrated network. So, you know, I had home care psych, I had a psychiatric hospital. All these surveys were going on either concurrently or right next to each other. But in any case, you will find out what you need to hand in within days of the closing. And we give you 60 days to do that. Most people hand it in within a few days. And as soon as you hand it in and it is approved, you are accredited, and that accreditation goes back to the time we exited. Now, once you have something to hand in and you have questions about it, that's where your account executive comes in. We're going to assist you in maybe an iterative process, so start early. And also you can call the standards interpretation group and get clarification. So you're not alone in trying to hand these things in. And then your final accreditation decision will be posted when we accept anything that you've handed in. And it will be posted on our public website. And the last bullet there has a little link. We do offer what we call a Publicity Kit. It's all electronic, but it's going to make recommendations on who you inform and some sample letters on how you would do that. Make it easy for you to tell the public. And of course, we're going to give you the gold seal, pins, and your award letter. Okay. Finally, we're going to come down to resources, and first and foremost, here's my team. My hair's a lot shorter now, but you know, that's me over there. And we do handle different regions in the United States, but don't be concerned about who you call. If you've contacted someone who doesn't handle that state, we'll get you to the right place. We'll get you started and we'll get you to the right place. So it's a great team, and we have a wide breadth of team members, some that have been surveyors for many years with the Joint Commission, others who have been with the Joint Commission itself for many years. So in our own team, we have lots of resources. And here is a slide just, to remind you that we have support throughout the process. And I probably said that more than I need to, but don't forget to take advantage of that. More resources, you're going to get these links. Okay, here's the link to our standard interpretation group at the bottom. And you'll see when you put in that web link that you're going to get a form and they're going to ask you to fill it out. So the reason we do that is because if you ask an environment of care question, we're going to get an engineer to answer it. If you ask an infection control question, we're going to get an expert in that area to answer your question. So we don't want to just take calls on the spot. We want to evaluate what the question is, in what chapter, and get the best person for you. They'll call you back and give you a consult. All right, so to close the presentation, I just want to say that when you get that gold seal approval, it really means that you've reached for and achieved the highest level of performance recognition really available in the behavioral health care field. So now we're going to open it up for questions, and I can take down my presentation if you would like. You just guide me over there on the other side so that I can see the questions or answer you without having a slide in my way. Let me know.
Hi, Yvonne. This is Nestor, and we do have some questions that have come through. I did expand the view, and I'm looking at them right now. I will say one of the questions that came through, you did a great job of answering during the presentation. It was, what is the benefit of being accredited through TJC versus another SAMHSA authorized accrediting organization? I think you did a great job in your presentation of going through the benefits of TJC accreditation. There's another question that came through. It says, we are a new IOP program with a goal to become JCAHO's accredited within the next 4 months. As the clinical director, what can I do to best prepare?
Okay, great questions. I'm going to go back a little bit to that first question, even though I did address it in the presentation. I didn't really do at least an overview of the comparison between us and other accreditors. Some of it is, of course, in the recognition and caliber, but there's a logistic difference, and that is we do not require that you have your clients on for any more than 1 day. All we need is 3 clients to do our survey, and we don't expect them to have been on for a few months prior to our visit. We don't expect you to be in compliance before we come, because you've gone through this process, and the accreditation process starts the day we arrive. That is different from other organizations, which at times require a 6-month waiting period and ask you to become compliant during that time so they can look back. So with your first-time survey, we don't look back. So when it comes to a process improvement plan or an emergency plan, your first-time survey is, what do you plan to do going forward? Not so much what have you done, although it's okay to talk about that, but we are going to, even if you've been, open for 10 years, we're still going to ask you what you're going to do going forward. The final differentiating feature that I think is important, and might be, you might not be able to see it, is that all our surveyors are employees of ours, and versus the other accreditors call in volunteers. And with the volunteers, I'm sure they're very, skilled in the field, but with Joint Commission, you have a consistency. They've been out in the field at least 25 times before they get to you, and they have a requirement to be in the field to do surveys at least 25 times a year. They are going to be experienced in the field, and you're not going to send someone to an IOP that hasn't experienced or run or worked in an IOP. So they're all clinicians, and they're all experienced in their field. And what that means to you is that we're at the ready. We're ready to go when you're ready for us, number 1. Number 2, you're going to get very consistent reports. You're not going to have one surveyor say one thing and the next time they come say another thing. And third, they're just really dedicated to our organization, and they're going to work with you as a team member you know, to help you get accredited and to find anything you need to have done. So I hope that helps a little bit. There are some differentiations. We charge you annually, not upfront. And I think that's probably enough for now. Okay. To answer the other question in terms of how you prepare for your IOP and you'd like maybe to be accredited within 3 to 4 months, I suggest you call me right away and we'll get started. And we'll get started with just the things I went through today, which would be your manual and your application. Some people do that concurrently because you're certainly welcome to. There's no need to wait for 4 weeks to review the complimentary copy. You can get your application in right away, and we just speed up the process. We'll tell the surveyors when you want your survey date, and we'll do everything we can to get you ready for that. We will come within 30 to 60 days from the date you tell us to come. So it's not, if you tell us June 1st, it's unlikely we'll land there right on June 1st, although it could happen. But it's somewhere in that 30-day window, and we'll give you 30-day, you know, advance notice. I hope that helped answer that.
You did great. You did great, Yvonne. We got a couple more questions that came through, and one of them you definitely touched on as well during your presentation, and it was, how does Kipu assist with Joint Commission data gathering? And I think you touched on some of that during your presentation. I don't know if you want to tackle that one or kind of review that quickly.
Sure. Well, certainly, you know, we don't require an electronic medical record, I should say that. But we encourage it, and most people have one. And the reason for the return on investment there is that you've got everything in one spot. Before electronic medical records came into being, so this, you know, puts the timeline back quite a bit, and I was running a psychiatric home care agency, we were all paper. And when I went into the filing room and the medical records room, I thought, oh my gosh, this is a miracle that we can find anything, okay? And when you go to an electronic medical record in Kipu, you have things all in one place. You have them documented consistently, and you know, certain fields can be required. And so you can set up your organization to gather information very consistently. Before we had an electronic medical record, it was all over the place. And, you know, so this helped us quite a bit. When you have reports that require data, whether it's how many are on service, what is your diagnosis on service, the care plans, all of those are very easily accessible if there's not paper all over the room, okay? So that the return on investment there will come back over and over for you. And I know you get good support from Kipu. Anything else?
Yeah, thank you, Yvonne. We had another question came through. Sorry, I had my phone on mute. It says, with virtual surveys, how do they interview staff and patients? Also, do we walk them around with a tablet/laptop so they can visually see the facility? Thank you, by Joseph. I didn't get the last name right, but that was the question that was submitted just a moment ago.
Okay, great. Now, some of you on the line may have gone through the virtual survey because it really became very robust once COVID started. And, you know, we were blocked, whether it was plane, automobile, or, you know, your level of risk in your community. So the virtual survey started in robust. It always has been around. But in order to survey staff or talk to staff, first of all, just like if we were on site, we'd get your permission. And if we were reviewing a file, we might ask if the clinician would come onto the Zoom call. And, you know, we can go through the plan of care. Because it's one thing to look at what's written, and it's another thing to have them articulate the process. So we would simply arrange it. We get permission, we'd arrange it. We may or may not speak to an actual client. So again, that is really, some clients love to talk and, you know, are very proficient at a Zoom session, and others would rather not. And that was the same when, you know, when we were on site. Some of my patients did not want Joint Commission to come. They were afraid they might get in trouble. I don't know why, okay? But we're going to work with your organization. on that. And yes, you do walk around with your iPad or laptop to have us take a look at the facility, the square footage, where you have your fire extinguishers and things like that. And I guess most importantly, and I will say that if you have a virtual survey, they're going to give you 30 days notice, but they're also going to arrange for a call 1 week or 2 weeks before the survey itself. And the questions that you have, good questions, you ask them all right there if they don't answer them right up front, because they know the typical questions people are going to have. And so you get a little bit of dress rehearsal, should I say, when you have a virtual survey.
Excellent. Yvonne, I want to thank you so much for your time this morning and participating in our Kipu Expo. And we appreciate the great insight that you've given us into the Joint Commission. And we hope that helps out our audience. At this point, I think this concludes our session. And again, I want to thank you so much for participating in this event. Thank you so much. And thank you to all the participants. Of course, you can reach Yvonne directly through the TJC if you have any further questions. And Yvonne, any last minute words?
No, just thank you so much, and don't hesitate to reach out, ask more questions, call me directly. I'm on the first page and towards the last page, and I'll get you started on anything you need. We're going to make it as streamlined as possible, and welcome you in as one of our high caliber gold seal providers. So thank you so much for listening today.
Thank you. Thanks everybody. We appreciate it.
Take care.